Hi, Deeksha. I'm just gonna add you on. Hi, guys. Thank you for joining today. Deeksha, if you just want to send me a request and you can join in, perfect. Let me add you.
Hi.
Hi, how are you?
Good, how are you? Can you hear me fine?
Good, yes. And you
Okay.
can hear me as well?
I'm just gonna increase my volume slightly. Okay, perfect.
Perfect. Is this your first live?
It is.
Oh, awesome. The first one's always a little nerve-wracking and then it gets better.
Yeah, I know. So yesterday I was like figuring out, okay, where should I put the camera? Does it need to be vertical, horizontal, or low? Obviously it's vertical,
Yeah.
but yeah, but yeah, I guess
It's
was
new territory. I've
yeah.
watched a few of them out there too since quarantine and everything started, and there's always a learning curve, and I think because everyone's in the same boat, there's a little margin of forgiveness. A lot of people realize, like, I heard from other people that, if you put your Wi-Fi off, it's like, at least in the States, it's easier.
Really?
It's just clearer because I guess the Wi-Fi keeps trying to reconnect versus like when you're on data, it just is always connected. And then like some people had their phones on the table and so it would echo when the other person talked. So it was like just new online territory.
Oh, wow.
But
But
how are
what
you
about for you?
doing?
Good, doing the best I can. I think
Yeah,
it's kind of, yeah, it feels kind of normal to be indoors all the time now.
I know. Yeah. How is it in India though? Like,
Well, we're still,
quarantine?
so they are opening up, but they're opening up much
Yeah.
more for the economy than for health reasons, because
Yeah.
it's not actually safer in terms of, the number of positive patients and things like that.
Yeah.
So of course we're staying put. We do have
So you
to
have to self
like step
quarantine.
out. Exactly.
Yeah.
Yeah. But it's so unless it's urgent, where for us nothing's really changing.
Yeah.
Up until it's actually health wise, it's safer for us to start
Right.
stepping out, given that we have a 3-year-old. So yeah, we
That
don't
must be
want
the
to risk it.
scariest part, right?
Hmm?
That must be the scariest part, trying to protect your child, because I know
Yeah,
family that has kids as well.
because she is getting quite sick of being cooped up, right? I mean, of course, we have like a garden and stuff that she
Yeah,
goes to, and
that
then
helps.
she has actually even Zoom school helps. So she has like school when seeing other kids and her teachers and stuff like that also helps. But I think just like,
Yeah.
oh, when will I go swimming next? When will I go to the zoo next? It's
It's a totally new normal. Yeah.
yeah.
Is she able to concentrate on the Zoom classes? Because it can be quite frustrating too.
Yeah. So she like 50% of the time, but they're quite okay with it. But it's funny because I think she's like, if it's data she hasn't paid attention at all, somehow she has retained everything that they went over.
Oh.
So it's like, I guess they're like kind of still listening, although they're like off doing something else. So I think it's fine. Initially I was like, why is the school doing this? Doesn't make any sense. They only need 3, but it's actually working out fine.
It's fine.
How about for you? Things are opening up there now.
Over
right?
here, yeah. So New York City is in phase 2. Where I am in Long Island, it's phase 2. In the city, it's phase 1.
Yeah.
So I guess the more in-person businesses like restaurants and nail salons, that kind of thing, are phase 3. So that'll be the last one. That will also be at a certain capacity only. So I mean, New Yorkers, I don't know. I felt like they were always smart and on top of their game, and which I think they are. But I think Corona also showed a new side of careless New Yorkers, unfortunately, which it took longer to flatten the curve. But now that we're there, and it's funny because it lined up with the weather too. The weather was quite cold when we were in quarantine, and now it's warmed up again. So I don't know if it's a mix of that too. Like, people, you just can't stop New Yorkers from getting out of their small apartments, of course. So it's just that people have to learn to follow wearing masks and stuff, which I feel like has improved. But it's not all the way there. So I think if that continues, then New York can stay safe for a little longer. But yeah, like I have friends in LA that said that most things are open as well. But then again, over there you have a little more space, a little more like outdoorsy air circulation. So it's a little, but thank God it's warm right now. So at least people, if they are meeting in groups, it's more outdoor and not, congested indoors.
Yeah.
So that's the good thing. But yeah, so let's hope that it maintains.
Yeah. Have you started stepping out?
Yeah, so I've because again I'm in the suburbs, so it's not so like in my face. It's still pretty populated. But I still go out with my mask and stuff. I still try to minimize grocery runs as much as possible. I was doing it once every 2 weeks. Now I'm like, okay, once every 10 days, that kind of thing. So I try to minimize as much as possible. And then we've been meeting close family and friends that have already been quarantined in Long Island. But mostly, like, if we're not meeting immediate family, we try to meet in like either balconies or backyards so that there's that sort of social distancing and like airflow.
Exactly. Yeah.
Exactly. So yeah.
Well,
So
at least things are looking up. So
I know, yeah. And so I was like, the good thing about this is that we can do things like this, which yes, we could have done before, but we just never made time for, you know. So I'm excited. So for everyone joining, this is Deeksha. She's the founder of LILAS, or is it Lila? Lila. And it's, so I have it right here. So it's a brand, and this is their first product that they launched with. It's, sorry, the glare of the light. But it's a pain patch. It's a patch for pain relief. And I've personally been using it since we met, which was, I want to say, what was it, like last October?
Yeah, I think
last
it was
fall,
end of
right?
September. Yeah, it was
September,
like
October. I've used it since then, yes.
Nice.
And thanks to, okay, so I just see my friend Leslie got on, and it's through her friend Olivia that connected us. So thank you for that connection, because it's been great. I love these things. I gave them to my sister-in-law when she was pregnant for her lower back pain. So even though it says it's a feminine patch relief for like your monthly cycle when you have cramps and things, but it works otherwise. I used it on my shoulder 2 weeks ago. I gave it to my mom for her lower back. So it's crazy how like versatile this thing has been. It's great. But yeah, so that's the brand that Deeksha has founded. And so we're going to chat a little bit more about that. So I'll go ahead and let you do your introduction as well in a little more detail.
Yeah, sure. Okay, so I'm Deeksha. I'm the founder of Lila Wellness. We're a women's wellness brand, and we develop natural, safe, and effective products for unmet needs in women's health and wellness areas. So my background has been in healthcare. I was a biology major, got my master's in public health, and then since then pretty much was in the pharmaceutical industry for 10 years. But I think just my time in the industry made me more and more passionate about women's health. And I think it was basically, for me, after the transition into motherhood, pregnancy, all of that was really the push that I needed to start something and to really do something in the women's health space. I think just being in the pharma space wasn't enough for me. I really wanted to change the way the women's wellness industry is evolving, and I thought the best way that I could personally add value from my professional as well as my personal background was through creating product, which is what I've done.
Yeah, and you've done a really good job. So when you were in the pharmaceutical industry, and then between that and when you you went through your own pregnancy and you sort of noticed this like gap for, as you said, for sort of women's wellness and an unmet need, what happened between those two? Like, what did you notice that sort of pushed this way?
Sure. So professionally, I guess what got me really interested in women's health was just how underserved it was. So historically, there was virtually no research done on women. So this is up until 20 years ago. Women, female cells, female animals, everything female was excluded from clinical research. Mm-hmm. And you could see that this is actually having a devastating impact on women, because up until 10 years ago, so all this is really recent, right? 8 out of the 10 drugs that were being pulled from the market were because of adverse reactions that women faced because there was a lack of research conducted on women. And even now, despite, so I think there was a little bit, of course, women health advocacy groups did a lot for women's health, but even now, unless it's a federally funded research, so women are not required to be included. So if it's a private research, exactly. So if it's a pharma company conducted research, there's no requirement really for them to include women. So for me, kind of, on a day-to-day basis, seeing how neglected women are, seeing that our industry is really doing a disservice to this segment, is what got, wanted me to do something in the space, got me interested. Of course, that paired with the lack of female leadership. So even as and when we are discussing women's health issues, it's usually just men discussing it, right? And it's very much from like a clinical standpoint or anecdotal. Yeah, I once heard my wife talk about this. There's really not enough representation, right? So,
yeah.
And it's not ill-meaning. It is well-meaning, but it's just, of course, having women around the table would do so much more, right? And then for me, I think as a consumer, when I was pregnant, then postpartum, kind of breastfeeding, I thought, again, like you said, there's a lot of back pain, nausea, hormonal fluctuations, a lot of symptoms that are kind of go with the fluctuations. You would walk into a pharmacy and there were just pills, or you have to go to your gynecologist, although there's nothing wrong with you, right? These are pretty natural things that you're experiencing, but there are really not that many solutions for you. There's no one, I'd say, like a women's OTC brand that I trusted, that I was like, okay, fine, I'll walk into my pharmacy and just pick up something for nausea, something for pain, something for headaches, and I'm done. They're just, I really felt the dearth of innovative products as a consumer at that point. And I think that's really when I decided that, okay, I quit my job in December. I had my daughter in May, but I think the realization I had up until then was, okay, this is the space that I want to be in. I've always wanted to be in healthcare, but I want to be a lot more focused on women's health.
Yeah, that's amazing. And like, so you were saying that you couldn't just go pick up something, and then also connecting that back to how you said that women are not part of trials. I feel like they just slap on that label where they're like, oh, in case you're nursing or you're pregnant or, have just check with your doctor. So they really leave it up to you, and you're already confused. You're already in pain.
Yeah.
And so, like, how are you supposed to just go and pick up those pills, right? I was listening to something that Gary Vee had done a little while ago, and he was just talking about how he was talking to another woman leader, and how boards and, of companies and stuff, board members were not women. And when she was starting to, like, be a part of that a few years ago, and part of that sort of movement and change, as they were getting used to it, they'd be like, but women are just, like, they would dismiss her because they were like, okay, you're being emotional, like, just step aside right now, collect yourself and come back. And he's like, we are human. We have emotions. So yes, men can be more logical, which works great sometimes, and women are emotional, which also works great sometimes. So it's about balancing the two. And without that emotion, right, like saying my wife went through something is not, they're probably looking at the studies and numbers and text, versus where women can be like, no, this is actually what we experience, right? So it makes a big difference for sure, I think. And I'm glad to see those changes. But the crazy thing is, just like, all this racism talk that we're having and learning about, that just as sad as that is, it's just as sad as, like, women in wellness, that why is it still a gap that needs to be filled, right? It should have already been filled almost, right? So, but it's nice to see businesses like yours that are changing that, and I think women out there are thirsty for that kind of stuff. So brands like yours will be successful and are successful because everyone's thirsty for that kind of product, and for that kind of a brand with a story, with a real meaning, right, from personal experience. So I think that goes a long way. And then, so how did you go about sort of starting so how did you decide, like, okay, this is the product I wanted to do, of course, based on personal experience, but then also, and of course you have your background in biology, but then how did you go about saying that I wanted this to be more of a holistic and not so, like, it's natural, it's, it's chemical free, that kind of thing.
So actually another really important aspect of the company, and it's our tagline, wellness for women by women, is that we involve women in every step of the process. So when we're deciding on what indication to go after, okay, now we're going to go after menstrual pain. Okay, what kind of solution do women want? Are they happy with what they're using? Okay, let's do a patch. Fine. Now in the patch, what kind of shape, what kind of fabric, what features should we incorporate? What are women actually going to use it for? I think having that voice was super important to us as a company, and it still is. And it's funny, kind of what you were talking about earlier. That it's like it's a board full of men, and then you have this one female trying to make a point, and it kind of gets like dismissed. That okay, well, you know, you personally are probably feeling like that. You can't speak on behalf of women. So it's interesting because when we were doing product development, it was kind of like that. We were working with, you know, of course, you know, the leading manufacturers in plant-based formulations, patch makers, and it's usually a team of men, right? And all these experts just happen to be men. And for me, I was like, okay, I need to have this market research and market survey so I can say it more convincingly that, look, I'm not representing my voice as a woman. I'm actually telling you what the research is showing you, because I've spoken to 100 of women, and they're saying that this is what's important to them. So that aspect of really kind of making the whole company focused on women and then giving women that voice was extremely important for us. And I think it paid off in the actual product, because the prototype that the experts had created was very different from the product that we ended up with when we incorporated all the feedback that we got from women. So again, so that was kind of
you built it based on their feedback.
Exactly. So the expertise component was important, but I think equally important for us was the market research that we did and the involvement from women in the entire process. And in terms of kind of, yes, and the more technical scientific component of it was that we did literature search to figure out, okay, well, what are the areas that are unmet when it comes to women's health? We spoke to women's organizations and associations. We spoke to experts to validate those findings, to really confirm that, yes, this is truly something that women are coming up to us, they're complaining about, they're dissatisfied with, and then saying, okay, fine, well, now let's move on to the next phase. Okay, when it comes to the FDA, where would we fall? What kind of products can we work with? Working with natural formulators to say, look, this is the FDA guidance. This is what we're trying to achieve for women. What kind of formulation can we create? Then having the manufacturer going back and forth with the manufacturer on different, like I said, fabrics, features, shapes, sizes, to really then narrow it down to the product that we have today.
That's amazing. Yeah, because you would think that, okay, you know, paint patches exist in like regular pharmacies, but because you were trying to make it based on feedback of what people actually wanted, felt comfortable in, you had to really go back and forth, even though similar products have existed in a sense, right? Like, so you really had to customize it.
For sure.
And I just want to show everyone, so I just opened one of the packages, and then we're going to go into her packaging later, because I love that it's all paper-based, it's sustainable, but like you said, that this is foil because of FDA regulations, right?
Yeah.
So I just want to show everyone that it's so it's a good size. And I can just smell it. I can smell the natural oils in it. It smells like a spa. And then it's very bendable, so you can really put it, and then you just peel it off at the back and put it on it. Sometimes, so it stays for how many hours?
So it stays for 12 hours.
Yeah.
And the patch itself is biodegradable, because it is
amazing. I didn't even know that. That's amazing. So, I mean, yeah, it's just such a breathable fabric. It's easy, and honestly, to me, it's way more effective, and we'll go into the labeling and reading the ingredients, but it's so effective, and because it's so comfortable and flexible, I forget that I even have it on, and then I just, you know, when I'm like changing my clothes at the end of the day, I take it off. I sleep with it. It's so, like, it doesn't get in your way. It's so comfortable. I love the product. And yeah, I think that's amazing that you did create it based on feedback, because that's honestly, like, I mean, definitely more small businesses and brands are doing that, but I think sometimes when businesses get too big, they lose that connection with the customer, and I think you guys do that really well. So I wanted to also ask, sort of in creating the product from a sort of business and small business talk, entrepreneurship talk standpoint, what were some of the hurdles? Like, I know you come to the States a lot, but you are away, and I'm sure you market all different countries, but I guess the US is sort of the biggest market. And then you sell on Amazon, which is amazing, so accessible, but like, just, you know, hurdles that perhaps you didn't expect, or you expected were harder as you were sort of building your business.
Yeah. So I think, well, let me actually talk again, hurdles come up all the time. It's just a part of running a business. But I'll talk more specifically about being away from your market. So we are trying to, I mean, our main focus is the US market. And of course, we're physically here. We go back and forth. But given COVID, you know, who knows when we'll be back in New York next. So I think from a networking standpoint, it's definitely challenging because meeting someone in person, having that connect, you know, going, and even if like nothing results from that meeting, I think it's just, you know, you have that bond when you physically meet. You don't always get when you are, you know, when you get on a phone or you just have a video conference. So I'd say from that standpoint, although digitally we're able to really reach out to our customers through Instagram and through Amazon and, you know, form those digital communities. What I do miss is kind of that physical presence that you have with partners or with customers. Actually, COVID in that respect, I feel like I've been participating a lot more in events because so many of them are now online. But I'd say a big challenge is that, and of course, in a small business, network does go a long way. So I think we have to kind of work doubly hard. So I always have to, you know, my day starts really early because I have a 3-year-old, but then my day has to end really late because I have to put in that time. You know, if you meet 10 people and make it connect, exactly. I have to probably speak to 20 people to kind of like make a similar connection. But it's, you know, it has its pros and cons. So being here makes me closer to the manufacturers and the formulators because India has so many, you know, because of Ayurveda, they've been working with plant-based formulations for centuries. So that physically being here, I can then have that physical connection with them. So as in when I have to meet them, I can actually physically go and meet them. I don't have to, you know, pick up the phone and then kind of go back and forth with them. So yeah, exactly. There are pros and cons, but I mean, I think you have to, as long as you're cognizant of them, and then you kind of make the effort to overcome them,
you can manage them.
You will overcome the challenges.
Yeah. That's so interesting what you said about being close to the factory, and because of Ayurveda, they are familiar with plant-based formulas. That's amazing because I feel like most factories elsewhere in the world, not everywhere, but most places would probably be unfamiliar with going back to basics and back to natural methods. So the fact that they have that familiarity, like I feel like it validates like their authenticity with those formulas, right? That's a great choice. That's awesome.
So even when we're talking about, I guess like even just in the process of developing this, right? It's like they just have such, because Ayurveda is a pretty clinically researched science. So formulators, when you speak to them here, they'll kind of give you 20 other ingredients that you have maybe not even heard of, that they're like, oh, this can do this, and you know, this is a magic plant, and this. So it really is from that standpoint. For when you're looking for natural formulations, it's amazing to be this side of the world.
At your fingertips. That's amazing. And then, so tell us a little bit more about the name, Lila.
Yeah, sure. So Leela is, my daughter's name is Leela as well, but her name is spelled the Indian way. So it's Leela. Leela, so our brand name is Leela, which means lilac in French, and is also our brand color. And then Leela, my daughter, was actually named after my grandmother. So it's kind of, and my grandmother is someone who I always looked up to. She was very forward thinking. She did a lot she was an anthropologist. She did a lot for, you know, tribal communities and stuff like that. So it's a name that means a lot to me for many reasons.
I love it. That's awesome. It adds so much more to your brand. I think it makes it more personable and it goes a long way. Awesome. And then so you've been, how long has the brand been, sort of since it launched? How long has it been around?
So I started working on this 2018. So I've been working on this for 2.5 years. Of course, our product development took quite a bit of time. And we launched this product in the US on Amazon.com about a year ago.
About a year ago. Okay.
Yeah. So it's been
and what have people saying? Like, what's the feedback been?
Honestly, it's been overwhelming. So I think if it works for you, people love it. And I always tell people, oh, this product changed my life because I was so dependent on painkillers, and now, at least for my period cramps, and now I'm not. And having customers actually say that, look, this, it has been a lifesaver. It's the miracle worker. It is doing all those things that we hoped it would. Of course, not every product works for everyone. So I don't want to say, oh, this is a true miracle worker that will work for everyone, because we are, bio individuals. Different things work well for different people. But I think if this works for you, this can truly be one of those things that change the way you look at, your pain, whether it's medication or exactly. Yeah. It can truly be transformational in your life.
I love it. That's amazing. Yeah, I like that you, as a business owner and a product developer, you're honest about that, because I think a lot of people are like, oh, everyone needs our product, and which is fine. Like, everyone can try the product, but like, I mean, even things like Tylenol and Panadol, right? Like, it can work for someone and it can do nothing for the next person, right? And it has nothing necessarily to do with how immune you are to the medicine. It's just that it might work for you, might not, right? It's never a blanket, like, work all type of situation. Yeah. And then, okay, so I wanted to go into just highlight the packaging a little bit, just because this is a personal bias of mine. Like, I love sustainable packaging that still looks cute. Growing up, I loved packaging. I always would buy the thing that had all the extra frills and all the extra packaging. But then as I grew more aware of sustainability, I now try to find things with the least amount of packaging. So I love that when brands can combine sort of beauty and branding with sustainable packaging. So I just wanted to show everyone. So you guys sell a 10-pack and a 5-pack, right?
That's right.
So this is a 5-pack. And then, so there's 5 of these envelopes inside. So they're individually wrapped. So if you're traveling, you want to put them in your purse or your work bag, it's so easy. And it's so skinny. It really, like, this is 5 and it's so skinny. It can fit anywhere. And it's paper, so it's recyclable. It's better than plastic. And yeah, I love that. And then even this is the 10-pack. Yeah, this is the 10-pack, and it's still paper. You can just open it, put it in the recycle bin, and it's great. And then I wanted to talk about the ingredients, because I personally found that very interesting. Just someone who's interested in this space but still doesn't have a biological background, I was able to notice that it's mostly menthol, right? So if you want to just quickly elaborate a little bit on menthol as a natural painkiller.
Yeah, sure. So so the active ingredient in our patches is menthol. It's menthol 10%, so it's a little bit of a higher concentration than other pain patches. But because of that, we don't need any, I'd say, chemicals in our inactive ingredients, because menthol does the job. So menthol is in the kind of, FDA has certain ingredients that they have tested and tried. They're safe and effective for pain management, and menthol is one of them. So if you're super interested in kind of seeing, okay, well, do active ingredients work? How do they work against other things? So NIH.gov is actually a great place to see all the clinical research.
Oh, interesting.
Now, so menthol is, like I said, clinically proven to be safe and effective in reducing pain. And by that, I mean there have been proper clinical trials that have tested that this does work. It's been tested against heat therapy. It's been tested against cold therapy. So it does work better than, icing yourself. If you have pain, it does work better than heat technology if you have pain. So the way it kind of does it constricts your nerves, so your sensation of pain that you feel. So that's kind of like the actual mechanism of action, is that you feel that cool, tingly feeling when it's on your body. And it's actually constricting the blood vessels. So the nerve sensation of the actual pain gets minimized.
Nice. Okay. Yeah, and I think that's, if you're gonna pop a painkiller pill, and if it does the same thing, this is less side effects, and
so painkiller actually gets your bloodstream, absorbs it, so it goes everywhere. Versus this is pretty local. Exactly. And then patches in general, I'd say are a superior product than gels and creams, because they actually go deeper into the skin. So when you use a gel or a cream, one, it gets rubbed off, so it's not on your skin for that long, because whatever you put your clothes on, things like that. and it only penetrates up until, I'd say, like the second layer of your skin.
Yeah.
But the patches once stay on, so the ingredient stays on your skin for a lot longer because it has that protective layer. And it actually, all the ingredients go all the way down to your tissue. So that's why the relief that you get from patches is usually a lot more from gels and creams. So again, it doesn't have to be kind of pelvic pain related, but even in general, if you use gels and creams, I would say, try a patch for your back pain or shoulder pain. It may actually work better for you.
Yeah, I mean, I can say from personal experience, me, my sister-in-law, my mom, we all used it and we loved it. So firsthand, I can vouch for that. So yeah, I love that's at least it's FDA approved for a natural ingredient, and that is something that I noticed, that you have a higher percentage, and so perhaps that's why it's probably even more effective than the other brands. And then I have a generic brand here that I got from the pharmacy. I'll try to cover the logo because I don't want to do any sort of calling out, but I'll just, like, these are the ingredients, I'll just read it out. So it says this one has menthol that's 5%, and you guys have 10%. So it's already double the amount of topical analgesic. And then in your inactive ingredients, you have the adhesive plaster, and then you have the eucalyptus oil, which I'm assuming is for just a more pleasant smell, is it? And just
so eucalyptus. Yeah, so eucalyptus, yes. One is definitely the soothing scent, and the second is it actually helps. It relieves the muscles, and it helps menthol do its job better. So it actually makes that menthol 10% even more effective. And then our adhesive is also all natural, so it's made of resin, which is tree sap.
Amazing. And then so it's biodegradable.
Exactly.
I love it.
So our active as well as inactive ingredients all are all natural.
Yeah, and it's the fact that it's like reading a food label, right? Like if it's like under 7 ingredients, it's great, and if you can pronounce all of them, it's even better, right? Whereas like this is like the just like the local drugstore, brands that we probably all used before, and then the inactive ingredients are like aluminum hydroxide, glycerin, and then methyl.
That's
things and there's quite a long list over here. So it's like, like when you see a product that can do the same thing and even better, honestly, in my opinion, and without all that extra stuff going into your largest organ of your body, your skin, and down into your muscle and your tissue, like, why not, right? So, so you guys sell on Amazon.
Yeah.
And then we're out through the website as well.
Exactly. So we were present in a few retail kind of wellness and fitness studios in New York, but of course everything's closed right now. So right now our majority is on our website as well as on Amazon. Okay. And we have kind of a few digital marketplaces that we're going to launch in soon.
Awesome.
So that's kind of the next step for us. But yeah, otherwise you can find us on our website or Amazon.
Okay, amazing. And then you ship worldwide.
So we ship actually
where do you ship?
Yeah. So it's actually just available in the US right now.
Okay.
So we are going to have a few additional markets that we launch soon, but as of right now, just in the US.
It just ships in the US. Okay, perfect. And then I think that was pretty much like all that I wanted to discuss. If there was anything else you wanted to add, and then we'll do the announcement for the subscription.
No, this was great. Thank you so much for giving the opportunity, for giving our brand the platform to kind of share our journey and talk about our product. And it's so nice to hear, because the last time we spoke, you hadn't tried the product. So it's so nice to hear that it worked out really well.
No, I've been using it, guys. Even update you, I've just been using them and sharing them. No, I do love it, and I'm not, like, obviously it's not biased, it's true, and I do love the product. I hope that it gets the success that it deserves. I mean, it's already in so many places. Like, I know you were at the Well in New York City, which is such an awesome space. And I hope that as sort of, things evolve and things get better, that it gets to a point where we can enjoy these wellness spaces again. And, and so people can also not only enjoy the spaces, but discover brands like yours. I think that would go a long way. And so that's pretty much it for the discussion, but I do want to make an announcement that Deeksha has generously, like for Aristos and all of our followers, for Lila followers as well, to enter a giveaway to win a, what was it, a 6-month subscription to the 5-pack packages. So you would get 6 months worth of those patches. And again, do they have an expiry date? Essentially, like
3 years.
3 years. Okay, so plenty. So 3 years, and they're individually wrapped, so you can open them as needed, and you can use them for, even though they're targeted to women, for your sort of monthly cramps, or I don't know what the right term is, but you can really use them anywhere, any muscle pain. So we will post on our account. So just look out for that post. And then the instructions to enter the giveaway will be on there. And so you guys can keep up with that and hopefully win a great product.
All right. Thank you again.
Yeah. Thank you. So we'll keep in touch.
Really nice chatting with you. I know.
Yeah. And hopefully we do this again soon too. All right. Take care. I'm going to say this on our account, Instagram TV. So feel free to share it after as well.
Yeah, we'll definitely do that. Thanks again. Take care. All right,
bye.